Prior to having surgery, there are a lot of questions and there's a lot of information patients should get. I think the most important thing is to be very comfortable with your surgeon, because when everything goes well, we're all heroes. When something goes slightly not expected, you want to know that you can speak to your surgeon and the surgeon's office, and they're going to be responsive to answer questions and allay any fears that you have and make you feel comfortable that the sky is not falling. Generally speaking, I think people don't spend enough time preparing their homes for what they're going to need to recover. Since more recovery is being pushed to the outpatient setting, to the home setting, it's important to have meals prepared. It's important to make sure that loose rugs aren't around normal areas where you're walking so you're not going to slip and fall. It's important to make sure that chargers for phones and things like that are readily available where you're going to sleep, where you're going to sit. In the old days, we used to actually be able to have home health care nurses go out and help prepare the home. Insurances have cut that back, so we don't have that luxury anymore. And so it's important for patients to get that information either from their surgeon or from a website that's a patient advocacy website so that they can prepare.